Chance fracture. The traumatic fracture of the thoracic or lumbar spine. Mechanism of injury involves a flexion distraction injury or a seatbelt injury. It is a horizontal fracture extending from posterior to anterior to the spinous process, pedicles, and vertebral body. Associated injuries may involve a high rate of gastrointestinal injuries, about 50%, and mechanical instabilities. Complications could involve several kinds of deformities, including scoliosis, progressive kyphosis, common with unrecognized injury to posterior longitudinal ligament, flat back leading to pain and a forward flexed posture, post traumatic syringomyelia, and the non union of the fracture. Treatment can be non-operative or surgical spinal stabilization depending on the presence of mechanical instability and neurological deficits.